So your pain isn't making any sense. Do you have tightness, tingling, sharp electrical pain? Some think it could be a tear or tendonitis. But what if it was nerve pain? I'm Dr. Justin Lin, nerve pain specialist at Rehab and Revive. Let's sit down and talk about it from our neuromechanical mindset. But first, please spend a few seconds to like our video, subscribe to our channel. If you found this video helpful in any way, please consider hitting the thanks button and donating. Also, our team has worked hard to bring online exercise programs to you. You can find the link to our Revive at Home programs below in the descriptions box. We appreciate your support. I want to preface that nerve pain and nerve pain science is very complicated. In the next few minutes, I plan to simplify these tough concepts in my words, the way I make sense of it. So why does nerve pain behave this way? There are a few reasons. 1, pressure from physical structures and inflammation. 2, irritation from spinal disc material, which is toxic. And 3, my prevailing theory is that it is short and has no ability to slide and glide. And this is one way I like to think of it. It's just this ability, if it was fine, like here, and then if it was short, I really can't move, and that's going to hurt every time. So let's talk about how nerve pain behaves. What happens is I created this nerve behavior scale back in about 2014 and realized through my own journey of nerve pain that things started off seemingly healthy. Then it felt like pressure, and then became hot-cold issues, then became pain, and then the nerve pain, the actual stuff really started kind of making sense, tingling, numb, and basically I started having drop foot for my legs, so that's motor paralysis. What you want to think of is that when things are good, you start off at this healthy place. Pressure could be even like a gripping, tickling, or kind of anything kind of feeling there. And then a hot, cold, sometimes people feel that hot sensation all the time, or a cold sensation. They think it's circulation. When you're in pain, that's when you start to feel that sharp pain or even that electrical type of pain going through. And so this is the degenerative process. And as it's going down this route, then you have the tingling or the pins and needles where it kind of just feels like, you know, something's on just not flowing as well. And then you've got the numbness, which means you're really not feeling anything. And just even when you touch the skin, it just feels kind of this like anesthetic or paresthetic type of feeling. And then the paralysis, motor paralysis, things like drop foot or things like inability to turn a doorknob or start you're dropping your keys because you just don't have enough of that fine motor. You're losing a lot of that. So what happens here is basically we kind of think of the nerve pain. A lot of times I think when things are getting caught, the structures are getting pinched, and these feelings is that you're basically pinching it over time. It's getting squeezed over time. And it could be because of a physical structure. It could be because of an adhesion or scar tissue. Your body creates internal scar tissue. So then it's just really got a good grip and you're not able to have it slide and glide nicely, which is basically what you want. And so we got techniques to free up the adhesions, and you want to do that. So as you get better though, this is kind of the way it behaves. And I think this is cool about recovery. You might start off at, let's say, worst case scenario is you're at that paralysis level and you start getting numbness, and then you start getting tingling. So if you started out numb and you're feeling tingling, it's not worse. In fact, it's actually getting better and progressively better. What a lot of people end up calling me at around their 5th or 6th visit usually is that they're in pain. They think it's worse off, that their last treatment was, something went wrong. A lot of times what happens here is that you went from numb, tingling to pain. That's a good thing. And I usually give them the spiel in their first session. And I always say, well, you're probably going to give me an angry phone call at about this point. And I'm going to tell you, remember that first talk we had? It's about going from numbness to tingling and pain. That's a good thing. Now, if you went from pain to tingling and numb because of your session, well, then that is progressively getting worse. That's the degenerative process. Something went wrong. So you want to keep going this way. Pain, and then as things get better, you might be feeling that hot, cold again, and then you go for your pressure. So people also start feeling a more dull ache after they've gotten better. that's normal, and then back to healthy. That's living life in a good way. So that's the way nerve pain behaves, at least in my terms, and kind of simplified because I lived through this. Now, also, what also happens to nerve is, I call this the nerve migration man, but this is the symptom of migration. A lot of times you want it to go centralized. You basically, and what I mean by that is you want it to go towards your spine. And so if it started off in your leg and you got tingling in your leg or tingling in your hands, you got those carpal tunnel type of syndromes, you have to realize that it all comes from these nerves. They're all compressed somewhere, somehow. And what you want to do is you want to be able to have it slide all the way back up. And you can see over here that the stem is thicker for a reason. So basically what happens is you're sequestering all your symptoms in here, and it might feel more intense here, right? It might feel more intense in your neck. But as all the symptoms have drifted away from your hands or your legs or your limbs, that's a good thing. Now, if they went reverse, that's a bad thing. So if you started off with this and now you're feeling tingling in your legs or your arms, that's no good. Something happened in your treatment. So you want to be mindful of that. For those of you out there who are seeking care with chiropractors and other physical therapists, you want to know that this is a bad thing. You want it to just stay central, closer to the spine. Now, as things get better, I always like to give the analogy of a toothpaste tube. You want to have it squeezing all the way up. And eventually you might feel headaches. So sometimes when you're doing nerve pain work, you could feel headaches. And that's what these rays are. Over time, you want it to move and drift up. Over time, what you need to realize is that nerve pain and pain is ultimately felt in the head, in your brain. It's what interprets pain. So it's okay if it centralizes back to the mothership, is what I call it. So that's what we want to do. We want to go all the way up and then eventually eradicate it out. And that's your pain journey, your nerve pain journey. And as you heal, that's what's going to happen. So what do you do if you have this issue? The best thing to do is get thoroughly evaluated. If nerve pain is truly what you have, there are great techniques like manual physical therapy, neuromechanical physical therapy, and nerve threading or glides as well to become biomechanically efficient. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, feel smarter, not harder.